name is Chua.
I'm Bernice.
I'm Serene.
I'm Yakini.
I'm Alejandra.
And I'm Elizabeth.
And we're here to talk about the female reproductive system.
So the female reproductive system. When my group first picked this system, I was excited. In my head, I'm thinking, oh, this is going to be interesting. I'm learning about my own parts. So time goes on and we're learning about the system and it hits me. It happens. I get my period. And this is the first time I'm excited for this time of the month. I'm stoked. So everything is going through my head. I'm sitting there on the toilet going pee and I'm overthinking everything. Progesterone, estrogens initiated this. They're at the lowest in the bloodstream right now. After ovulation, the discharged ovum is going to my abdominal cavity. It enters the uterine tube. The vertebrae is going to help it move along. When it's in the tube, it's going to go to the uterus. My endometrium is going to loosen. Everything's going to drain out of me, and it's going to end in no time. So then I started thinking, well, what if I didn't have my period? Then what would happen? So the sperm would go to my cervix and my uterus to meet the ovum. My endometrium, instead of loosening, would thicken and nutrients to house the baby. And so moral of the story, I was sitting there on the toilet for a while.
So I'm here to talk about regular checkups and why they're important. The organs and the structures of the female reproductive system help give women the ability to have children. And regular checkups with your OBGYN will help with this ability. Many women think that there's no need for regular annual OBGYN checkups, but it's actually very important, and pap smears aren't the only thing your gynecologist is looking at. These visits are used as a well-woman checkup to assess other aspects of your health. General help for women between the ages of 13 and 15 are usually when it starts. Women between the ages of 13 and 15 usually start to visit their gynecologist, or when they begin to have sexual activities, whichever happens first. If symptoms of a problem occur, an abdominal and pelvic exam will be done at around age 19 and routine pap smears at age 21. In order to keep track of your health, your OBGYN will check your weight, your blood pressure, and ask you questions about nutrition, exercising, sexual activities, and they will help you keep up with immunizations, and as well as giving you birth control options. And performing routine breast exams to help scan for lumps and irregular tissue that you may have.
So we've talked about the importance of getting regular checkup, but now I'm going to give you a specific scenario. Cervical cancer used to be one of the main causes of deaths in women. However, that has changed in the last 40 years. The death rate has gone down 50%, and the reason is because of pap smears and screening programs. A pap smear is a screening for cervical cancer that takes sample cells from the cervix area to see if there are precancerous cells. If you catch precancerous cells, you have a survival rate of 97%. However, that rate goes down at the latest stages of cervical cancer to 17%. Okay, beforehand, women did not get regular checkups due to reasons like insurance. They weren't educated on why it was so important, or financial reasons. However, there are now screening programs that provide efficient ways for women all over America. Places like Planned Parenthood give women, are saving lives not just for cervical cancers but for other women. Women who get regular checkups will not develop cervical cancers later on, which is important because 50% of cervical cancer is 50% of cases of cervical cancer are with women over the age of 65. So please take care of your body and use the resources near you.
The female reproductive system is the center of a powerful capacity to changing the world. even if it is not essential to keeping one alive, but it is essential to keeping us as a species alive. But without proper care, it can affect us mentally and emotionally. Obesity caused by an unhealthy diet can be fatal to the health and to the heart, and also the health of the female reproductive system. Overweightness lowers self-esteem and creates stress. Stress can cause irregularity of the menstrual, and when alcohol is brought into the picture, it can be painful. As a result of all this unhealthiness in our reproductive system and the region became more vulnerable to infection and disorder. The loss of having such a disorder because of our unhealthy choice and action is a fright to many of us. But not all disorders are alike. For example, endometriosis is not dangerous to us. Endometriosis is the development of endometrial tissue outside of the uterus. There is not much knowledge of the origin nor a prevention from it to happen. Nor is it dangerous to us, but can be really painful. The pain can be prevented. It is as simple as staying hydrated or exercising and having a low balance of fatty foods. In fact, we shouldn't fear the disorder because it is only found in 11% of women between the age of 14 and 44. The symptoms include abdominal pain, irregularity, menstrual, and have a lower rates of infertility. You can still have babies if you have this disorder, so we shouldn't fear being childless in our life with this disorder. Thank you.
So others may think of creating the perfect baby with a cute smile, adorable laugh, or pretty blue eyes, and cute chubby cheeks. Now let's change the subject. What comes to your mind when you think of cancer? Raise your hand if you yourself or your family members have been affected by cancer. So there's a lot. So for every 100 people, 66 people do not die from the 5 years of when diagnosed. But that's only 100. So in 2016, there's been 1,600,000 people who have been diagnosed with cancer. And out of that, 595,000 people had died from that. So now let's talk about uterine cancer. Uterine cancer is 200,000 cases per year, as well as ovarian cancer. In the year 2016, 61,380 females had estimated to die from endometrial cancer. 1 in 50 women get endometrial cancer in the United States. So 1 in 50 women get endometrial cancer. In the United States, endometrial cancer is the most common gynecologic cancer and the 4th most common cancer among women. So when it comes to cancer of the female reproductive system, many elements are affected. Hormones wouldn't get produced as well, such as estrogen and progesterone, that is triggered by the hypothalamus and prepares the uterus for menstruation. So as I said in the beginning, cancer affects so many people in the world. It would be very heartbreaking if this would happen to you or your family members. Thank you.
Not only going to the clinic means keeping yourself healthy, but you can also keep the female system healthy by doing a few things at home. Some of the few things that I'm pretty sure most of you women do is drink a lot of water and keep the genitals clean by showering every day, or at least Some of the few things that I'm pretty sure most of you women do is drink a lot of water, keep the genitals clean by showering every day, or at least I hope you guys do. Be careful by not getting into contact with another person's blood or other bodily fluids. Maintaining a healthy weight and getting regular exercise is important because being overweight is dangerous to your health and can cause diseases and can prevent you to have children and can cause you to miss periods. Eating healthy meals such as a balanced diet that is high in fiber and low in fat can be good for your health.
Okay, so boys, I'm pretty sure you may think this is all pretty disgusting, but this is what happens in the female's body. This happens to your mother, your girlfriend, me, any female you've ever known. This is how I got into this world, how you got into this world, and how everybody standing before me got into this world. So now that we know about the female reproductive system, maybe next time I won't be the only one sitting on the toilet rethinking over all of this. Thank you.